So, in the same order as before, now the medical test results. I was so happy to lead the task with many participating partners. We used to have meetings with about 60 people in the room. Unfortunately, not during last month, but that's part of our usual work. So I will just briefly repeat what you have heard in several alternations already before. So what was the objective of our work? So we were asked to develop the functional and implementable specification for medical test results, including laboratory results and reports. That was a challenge of its own, and I will mention it a little bit later. In that description, we try to cover all the levels of European refined interoperability framework. That means from the business level, regulatory level, up to the technical level, of course, with different focuses and level of details that we were focused on. The major focus was, of course, on the data set, and also, which has been mentioned here several times, including preferred code systems and value sets for the implementations, and also the testable requirements. Expressed in our case in two different forms. One was a functional requirement, and then the data level obligations. The major challenge is, first of all, the complexity of the task, because our task covered very broad type of observations, coming from observations which are made in the general practices up to the through the observations made by the specialist, up to the laboratory observations, which is a special, let's say, special kind regarding the way how they are and where they are being performed. And usually the major differentiation factor is that lab is usually seeing the specimen, while the physicians are usually seeing the patient, not so often the specimen. However, and that was one of the challenges that we faced, because we need to balance between this very broad type of observations, which we cannot describe in detail for all the possible cases, and the need to be specific enough to allow for a meaningful implementation. So that was the first challenge. The second challenge from my viewpoint was that the priorities from our client has evolved over the time. So we have learned during the project what else needs to be done. It was just a challenge. I am not saying that it was unwanted or that I didn't like it. It was a challenge. I already have mentioned some time that we have spent discussing what would be the right tools and methodologies to cover these requirements from our client, which was the Commission and the member states, of course, the e-health network. One of the feedbacks that we have received was, please specify clearly the differentiation between medical test results and laboratory test results. We've spent quite a lot of discussions around that, because we see rather very much simplicities between those two. So it was not easy to specify them or to define them with appropriate level of differentiation. We tried. I think that we produced a relatively comprehensive and good definition. We will see how the member states will like it, and that was one of the achievements that I think we can be proud of. Another problem was that we were asked to describe use cases. I mean, the priority categories that included medical test result and related reports. Medical test results could become part of many different types of reports, so we definitely couldn't describe them all. So we had to focus rather on the laboratory result reports, but describe it in the way that could be general enough and concrete enough in the same time to be applicable also for other types of reports, like discharge reports from hospitals or ambulatories or patient summaries, for example. So that was another challenge. And then we felt the need to also specify in our functional requirements some of the requirements that would fall into the category of data quality. And from the feedback from member states, some told us, you should not do that because that's a matter of the suppliers of the information solutions, and that's a matter of their customers, what they want to see. But we still want let this part in our deliverable because we saw a clear foundation for this in the regulation, the data quality. And we felt a need to specify general criteria, like, for example, if you present a result of some measurement, you always should present it with the result measurement unit. So we try to specify what needs to be presented, but not specify how it should be presented. And the how is then the domain of the implementers and software vendors. And the last challenge was the number of received comments from the public consultation. We had something 1,600, I think, and it was the lowest number of all the tasks as far as I know. So that was a challenge, real challenge for everyone. And I've spent the last 3 months only doing this. Our achievements, refined data model has been mentioned also by Daniel and others. And I think that after several rounds of harmonization across different use cases, we now can speak with single language independently of the use case, but specific enough, again, for our special cases. That's why we created 2 logical models, one for general observations, let's say we call it medical test result, and a specific one which has some additional information in the laboratory test result logical model. Rationale of selection of code systems, yeah. Actually, we all know that ideally everyone in Europe should use just one preferred code system. That would be the simplest way how to be interoperable. However, the reality in Europe is much more diverse. We know that we have at least 2 prevailing code systems for the laboratory test result code, test coding. That's LOINC and PU. And we now had been asked, what is the recommendation? And we come up actually with recommendation to use 3 code systems. And we created the rationale, the reasons why we think that this is the way forward. And that's one of the achievements that I am proud of. But the major thing that I'm proud of is that we really succeeded to build a real core team around laboratory and in wider sense around the medical test result observation. And that team is continuing working, and I believe that it will continue working even after the end of this project. Under the umbrella of HL7, actually the history of this team is much longer. We started with Cross eHealth project and still are meeting because we feel that there is still a lot of things that needs to be solved and the work needs to continue. And major thing that I'm proud of, we kept a good working attitude to the whole run of this project, more than 2 years. So what needs to still to be done? We did not finalize the work on microbiology reporting. This work is continuing. We are now in a preparation of a white paper that should be published hopefully before summer break. And then based on that, we should achieve the implementation in 5 RGs for microbiology, because that's a specific area of laboratories. Most of you know it well, but it's not as much, let's say, deterministic as other type of laboratories. There is much more freedom of selection of the way how they perform their investigations in order to achieve the result value, which is not only what they have found, but the sensitivity of against the ITB, the principles why of multi-resistancy of the agents, etc., etc. So that's a little bit different from classical laboratories. Another area which we have not yet touched is the laboratory of genetics or genetics laboratories, which we will partly cover in the microbiology part, but there is still human genetics is open for. The reason is simple: we didn't have enough expertise in that area, and there is not, let's say, from the international point of view, the standardization does not reach yet the level that we can just reuse. So that's why that we need to work on it. Histopathology is the third example of lab area, which is not yet fully covered by the specification, except of the free-form text reporting, of course. That could fill in our current IG without any problem, but that's not what we want from long-term point of view. But the real challenge was not the specification itself. Technically, we can do relatively soon, we can cover all of these areas. But the real challenge is the harmonization, the implementation of those specifications in a real practice. That is not only about proper test coding, because there are still problems even inside the countries which are using one code system. There are differences how the laboratories are implementing the mapping to this, or the understanding of the content of those codes. So those are challenges that are ahead of us, and that's the most wild and interesting part, that all the member states now should reach till some meaningful date. 2031 is the deadline, but it's clear that it will not be perfect. So let's understand this as a long-term engagement that we need all to work on. Otherwise, the interoperability would be just an illusion, and the patient safety as well, because observations are the basis for diagnostics. Full implementation of the observation model. The observation model, it's another, of course, very difficult part, is quite rich, because it should cover many possible aspects of the observations. But those elements are there not because I like them, but because they are necessary. Because they are necessary for proper interpretation, for comparison of result values. And at this moment, how many information systems are able to share information about certified reference material in laboratory? Just few, if any. But we know that we need it. That's why we put it there. So that's another challenge. And that's my last word. Thank you very much.